As the national questions about Ebola continue to mount, hospitals in and around Louisville are preparing in case a patient is diagnosed here. WLKY's Christina Mora has the latest on how local facilities are preparing.
Right now, there's a whole lot of information, even misinformation out there about Ebola. And local hospitals here in Louisville say they're continuing to evolve their practices, and they're ready if an Ebola patient walks through their door today.
You'd have to have contact.
Dr. Chris Bryant is the epidemiologist at Coast-Air Children's Hospital and an infectious disease specialist with U of L Physicians. She says Norton Healthcare has been preparing for an Ebola patient for weeks, and that includes what to wear.
Early this week, the game really changed, and CDC said we're considering full-body suits. We didn't really wait for we don't have a final list of recommendations from CDC yet, but we've made the decision to go with full-body suits.
Kentucky One Health, which includes University Hospital, sent us this statement about its staff. They are closely monitoring the virus and are in regular contact with state, local, and federal health officials to ensure training and equipment meets or exceeds guidelines. And what about travelers at Louisville's airport? You may not notice anything different here, but you will if your destination is one of the 5 airports with new screening procedures. JFK, Chicago's O'Hare, Dulles International, Hartsfield-Jackson in Atlanta, and Newark Airport. Those are all on the list. The U.S. Customs and Border Protection Office told WLKY travelers here will not see advanced screening measures at the airport, but they may become more aware of the screening measures at other airports. And your traveling history will likely come up the next time you're in front of a doctor.
We started asking patients who come to any part of Norton Healthcare, have you traveled? Have you been to one of these countries in West Africa where there has been transmission of Ebola?
Dr. Bryant says if a local patient was diagnosed with Ebola, the CDC would be in town within hours to help. In Louisville, Christina Mora, WLKY News.
Ebola is spread through the transmission of bodily fluids like blood and can live up to several days at room temperature. A person is contagious when he or she is showing symptoms anywhere from 2 to 21 days after exposure. And on its Twitter account, the CDC reports Ebola can live on doorknobs, countertops, and other hard surfaces for several hours.